Think of the infertility journey like, well, like running a marathon. But the finish line just keeps moving.
Yeah, you don't even know where you're running to half the time.
Exactly. I mean, you train, you prep, you pour absolutely every ounce of your energy into just taking the next step. And then, just when you think you're finally there, the tape is pushed back another 5 miles.
Right, it's incredibly taxing.
It really is. So we are diving straight into the profound and honestly, often completely hidden emotional landscape of that journey today.
And it's a deep dive that is so overdue.
Totally. We're exploring the intense psychological toll it takes on you, and we're mapping out how holistic, complementary therapies, specifically things like acupuncture and Chinese herbal medicine, aren't just, cute, feel-good additions to a routine.
Right, they are scientifically backed interventions. They actively disrupt the biological cycle of anxiety.
Which is huge. And to guide this deep dive, we've got a really solid stack of sources. We're pulling from recent NIH meta-analyses, some incredible insights from the Berkeley Center for Reproductive Wellness right here in New York City, and patient advocacy data from Resolve.
Yeah, and the clinical literature paints this picture of a journey that, for decades, was treated as just a purely mechanical issue.
Like it was just about the plumbing.
Exactly. Standard medicine focused almost exclusively on, follicles, sperm morphology, uterine linings. But the psychological terrain is arguably just as complex and physically impactful.
I mean, we are talking about pervasive grief, anger, profound shame, and just a relentless sense of failure that literally permeates every single aspect of a person's life.
It really does. It takes over everything.
So let's break down that emotional terrain a bit, because the gender divide in how this grief manifests is pretty striking.
It's drastically different between partners, yeah.
Right. For women, there is often this deeply internalized narrative of a failing body. It's tied to these immense societal expectations, which creates this just vicious emotional cocktail.
Oh, absolutely. It's that intense jealousy when you're confronted with pregnant friends or baby showers.
Which is immediately followed by overwhelming guilt for even feeling that jealousy in the first place.
Yes, the guilt is massive. And then comes the isolation.
The isolation is so real. I mean, imagine navigating this in a hyper-dense environment like New York City. You are surrounded by millions of people commuting shoulder to shoulder on the subway, passing dozens of strollers on the sidewalk.
And yet you're feeling completely unseen, entirely alone in your struggle.
Exactly. And that isolation is just compounded by the brutal monthly roller coaster of hope and disappointment.
Right. But we also have to talk about how men carry this emotional weight, because it's just as intense, but the manifestation is entirely different.
How so? Like, what does it look like for them?
Well, male factor infertility, things like low sperm count or poor motility, it frequently strikes right at the core of perceived masculinity. It triggers a really profound shame.
Oh, wow. I hadn't really thought about it that way, but that makes sense.
Yeah, and because society still actively discourages men from voicing vulnerabilities, they tend to internalize the trauma.
Right, they just bottle it up.
Exactly. So instead of seeking support, men often lean into irritability, or they just bury themselves in work. They emotionally withdraw completely.
So you end up with two partners who are experiencing the exact same crisis, but they're processing their grief in completely opposite directions.
Right, they're drifting apart when they need each other the most.
And the intimacy that initiated the desire to build a family in the first place just morphs into this clinical, mechanical schedule.
It becomes a chore.
Yeah, and then arguments over the endless financial drain of treatments and the direction of medical care start to spike. Couples find themselves experiencing severe loneliness while sitting right next to each other on their own couch.
And that intense emotional friction, it doesn't just stay confined to the mind. That's the crazy part. It triggers a profound biological cascade. The body begins to interpret this constant emotional pain as a literal physical threat.
Okay, let's unpack this.
Yeah.
Because this specific dynamic drives so many people absolutely crazy. You constantly hear that unsolicited advice from people, oh, just relax and it'll happen.
Ugh, the worst thing you could possibly say.
Right. Which, when you are drowning in medical trauma, is objectively infuriating. But based on our sources, is there actual biological truth to the idea that the stress response is actively blocking conception? Like, are people who say, just relax, actually pointing to a real physiological barrier, even if their delivery is completely toxic?
This raises an important question, and we really have to get the nuance right here so we don't accidentally validate that dismissive advice.
Good point. We definitely don't want to do that.
Because telling someone navigating infertility to just relax is completely useless. It fundamentally misunderstands neurobiology. You literally cannot consciously will your nervous system to power down.
Right, you can't just think your way out of a panic attack.
Exactly. However, the biological disruption they're so clumsily referring to is undeniably real. When you are under chronic emotional distress, your body aggressively activates the HPA axis.
The HPA axis. Remind me what that stands for again.
It's the hypothalamic pituitary adrenal axis.
Ah, right. The body's central fight-or-flight alarm system.
Yes. So, when that alarm rings cycle after cycle, month after month, the hypothalamus secretes hormones that tell your pituitary gland to trigger the adrenal glands.
And then the adrenals respond by just flooding your entire system with cortisol.
Right. And from an evolutionary standpoint, your body is incredibly pragmatic. High cortisol signals that you are in a constant life-threatening crisis, like a tiger is chasing you.
So the brain basically decides this is the absolute worst possible time to try and reproduce.
Exactly. It actively downregulates the production of gonadotropin-releasing hormone, or GnRH.
And without sufficient GnRH, what happens?
Your levels of luteinizing hormone and follicle-stimulating hormone just plummets. This directly interferes with ovulation, it disrupts the luteal phase, and it even impairs spermatogenesis in men.
Wow. So the emotional trauma of infertility creates an internal environment that is literally hostile to conception.
Yes.
Which then makes conceiving harder, which generates more grief, which pumps even more cortisol into the system. It is a brutal, self-sustaining biological feedback loop.
It really is a physiological lockdown. And you cannot break a lockdown HPA axis by taking a deep breath or trying to just, think positive.
Right, you need something stronger.
You do. Breaking that loop requires concrete physiological interventions that actively force the nervous system to shift out of that sympathetic fight-or-flight dominance.
And shift it back into a parasympathetic rest and digest state.
Exactly.
Well, that brings us perfectly to the intersection where Eastern medicine meets modern neurochemistry. The sources highlight acupuncture and Chinese herbal medicine as these powerful complementary therapies.
And complementary is the key word there.
Right. These are utilized alongside conventional IVF or IUI protocols. They serve as allies to your reproductive endocrinologist, not replacements for them.
Exactly. You're not choosing one over the other.
But let's look at the actual mechanics of this because it sounds a bit like magic. How does inserting extremely fine needles into the skin pull someone out of a cortisol flood?
It all comes down to manipulating the nervous system. The insertion of those needles at specific dermatomes creates what we call microtraumas.
Okay, and the brain notices those.
Right. The brain registers these microtraumas and responds by releasing endorphins. But the systematic reviews show the impact goes much deeper than just temporary pain relief.
So it's not just about feeling a little bit of buzz.
Not at all. Acupuncture actively stimulates the vagus nerve. And by increasing vagal tone, the therapy forces the HPA axis to downregulate.
Oh, wow. So it halts the overproduction of cortisol.
Yes, and it actively modulates major neurotransmitters too, specifically increasing the availability of serotonin and dopamine in the brain.
Are acupuncture and herbs essentially acting like a circuit breaker for the nervous system? Like when the body is stuck in a fight-or-flight stress overload with the engine running entirely on cortisol, these treatments just trip the breaker to allow the whole system to finally reset.
What's fascinating here is that the clinical data shows this circuit breaker analogy playing out in real time.
Really? Like you can actually measure it?
Yes. Patients exhibit measurable drops in clinical anxiety scores after single sessions, just one session.
That is incredible.
And that neurological reset forces the blood vessels to dilate. See, when you are stressed, blood flow is diverted away from the reproductive organs and pushed toward the limbs for fight or flight.
Because your body thinks you need to run away.
Exactly. So by tripping that circuit breaker, acupuncture restores robust blood flow back to the uterus and ovaries.
Which I imagine is pretty critical.
Oh, it's essential for delivering oxygen, nutrients, and frankly, the very fertility medications the patient is taking.
Okay, I definitely understand the needles stimulating the vagus nerve and tripping the circuit breaker. That makes sense. But where do the Chinese herbs fit in?
They're a massive part of the equation.
I mean, I get the appeal of a customized herbal formula. It sounds nice. But how does drinking a tailored tea or taking an herbal powder actually reset a neurochemical loop? Aren't we sort of bordering on the placebo effect here?
I get why you'd think that, but the pharmacology behind these custom formularies is highly complex. We aren't talking about generic chamomile tea from the grocery store to help you sleep.
Right.
Chinese herbal medicine involves specific phytochemicals that interact directly with cellular receptors in your body.
Okay, so they're acting almost like a medication.
Very much so. For instance, certain roots and barks used in these formulas contain compounds that act as powerful adaptogens. They actively help the adrenal glands regulate cortisol output over time.
Oh, so they're sustaining the work the acupuncture started.
Exactly. Other specific herbs act as vasodilators or possess active compounds that modulate smooth muscle tissue.
Smooth muscle tissue, like the uterus.
Precisely. In the context of an IVF cycle, reducing microscopic uterine contractions post-embryo transfer is absolutely vital for implantation. The herbs work systematically to maintain the parasympathetic state the acupuncture initiated.
And building on that parasympathetic state has to lead to secondary benefits, right? Which might actually be primary benefits when you're just trying to survive the daily grind of the journey.
Absolutely.
Like by downregulating anxiety and balancing dopamine and serotonin, your sleep architecture must improve. And you cannot process complex grief or maintain emotional resilience if you are running on like 3 hours of fragmented sleep.
Sleep is the foundation of neuroplasticity. You need it to function. When sleep improves, your baseline irritability drops significantly.
Which means the couple stops fighting as much.
Exactly. When both partners are less constantly on edge, that communication breakdown we discussed earlier really starts to heal. They gain the emotional bandwidth to stop attacking each other over treatment schedules and start functioning as a united front against the infertility itself.
Here's where it gets really interesting. Because applying this incredibly complex neurochemistry to a fragile patient population requires a very specific kind of clinical environment.
It really does. You can't just do this anywhere.
Right. The sources talk about Mike Berkeley of the Berkeley Center for Reproductive Wellness. He was actually the first acupuncturist in the United States to specialize exclusively in this field.
A real pioneer in reproductive wellness.
But his approach wasn't just academic. It was forged in his own harrowing experience with dual-factor infertility. He and his wife navigated both male-factor and female-factor challenges simultaneously.
And experiencing that dual-factor diagnosis firsthand provides a truly visceral understanding of the trauma.
I can only imagine.
I mean, when you have navigated the shame of male-factor issues yourself, while simultaneously watching your partner endure the profound grief and physical toll of female-factor treatments, you develop a profound clinical empathy.
It changes everything about how you practice.
Exactly. That lived experience dictates the entire architecture of the patient experience at his clinic.
So let's look at what actually happens when a patient walks into that environment. A traditional reproductive endocrinologist's office, by necessity, is incredibly focused on the mechanics.
It has to be. It's science.
Right. It is sterile, it's clinical, and it's heavily metric-driven. They are measuring follicle sizes, checking hormone titers, scheduling egg retrievals. You often feel like just a set of data points. So how does a specialized acupuncture center operate differently?
Well, the environment is actively engineered to downregulate the nervous system the absolute moment you walk through the door.
How do they do that?
The grief, the relationship strain, and the pervasive shame we talked about, they are acknowledged head-on right from the start, rather than just being ignored in favor of reading a medical chart.
That sounds so validating.
It is. Patients at centers like Berkeley's undergo twice-weekly sessions leading up to retrievals or transfers, and they utilize highly specific, timed interventions.
Like what kind of intervention?
Like the Paulus protocol, which involves receiving acupuncture immediately before and immediately after an embryo transfer.
Wait, immediately before and after. So they are actively applying that circuit breaker right when the patient's anxiety and therefore their cortisol levels and potential for uterine cramping are at their absolute peak.
Exactly that. By validating the emotional burden and providing a dedicated, quiet space for the nervous system to physically relax, the shame begins to dissipate.
It's like treating the whole person, not just the reproductive organs.
Right. The patient isn't just receiving vasodilation to their uterine lining, they are receiving psychological validation from a practitioner who literally survived the exact crisis they are currently navigating.
That has to be so powerful.
It is. They leave feeling physically prepped for their conventional medical procedures, but also emotionally equipped to handle the outcome, whatever it may be.
Okay, so while specialized clinical centers like that offer incredible targeted interventions, the clinical reviews do emphasize that acupuncture and herbal medicine are most effective when they are nested within a much larger, comprehensive ecosystem of support.
You can't just do acupuncture and ignore the rest of your life.
Right. Rebuilding emotional balance requires a multi-pronged approach.
Holistic support demands looking at the entire lifestyle of the patient. The toolkit has to extend far beyond the clinic walls.
And the first critical avenue the sources point to is partner communication.
Yes. The specific tactic highlighted in the literature is brilliant in its simplicity, honestly. It's about scheduling strictly non-treatment check-ins.
Oh, I love this idea. Carving out, 20 minutes where you and your partner talk, but with an absolute ban on discussing the next IUI cycle, analyzing the latest clinic bill, or debating sperm motility.
Exactly. It is a dedicated window with zero pressure to fix the infertility.
Which I bet is incredibly hard to do at first.
Oh, it's very difficult. But it forces couples to preserve the identity of their relationship outside of the medical trauma.
That makes total sense. What's next in the toolkit?
The next tool is professional mental health support. Processing the complex, compounding grief of consecutive failed cycles often requires a specialized reproductive counselor.
Because standard therapy might not fully grasp the medical nuances.
Right. And in cases where the HPA axis disruption has led to severe clinical anxiety or depression, consulting a psychiatrist is paramount. Utilizing short-term medication to stabilize your neurochemistry is a valid and honestly often necessary medical intervention.
There's no shame in needing medication to get through it.
Not at all.
And then there is the community aspect. Organizations like Resolve provide support groups that serve a very specific function.
They are lifesavers for so many people.
Because you are connecting with people who fluently speak the language of infertility. You don't have to explain the excruciating anxiety of the 2-week wait, or justify why a casual pregnancy announcement from a coworker sent you into a total tailspin.
And that shared understanding breaks the isolation we talked about earlier. You realize your seemingly irrational emotional reactions are actually incredibly common, completely normal responses to chronic trauma.
So what does this all mean? It brings us to the individual self-care tactics. Things like gentle exercise and mindfulness are pretty standard. But the crucial point the sources make is strictly limiting social media.
Yes, that is huge.
I look at this as curating your emotional diet. If your nervous system is already overloaded with cortisol, scrolling through an endless algorithm of gender reveals, baby announcements, and perfectly curated family photos is like feeding yourself localized spikes of panic on a silver platter.
That's exactly what it is.
You are actively triggering your fight or flight response from your own couch.
If we connect this to the bigger picture, every element of this toolkit, managing your emotional diet, implementing those non-treatment communication rules, joining a Resolve group, and utilizing acupuncture to biochemically reset your vagal tone is ultimately about reclaiming agency.
Reclaiming agency, I like that.
Because infertility fundamentally strips away your sense of control over your own body and your future. Actively managing your psychological and physiological stress response allows you to take that control back.
We do need to address a critical medical caveat that runs through all the clinical literature, though. You must coordinate any complementary therapies with your reproductive endocrinologist.
Absolutely. Do not keep secrets from your doctor.
This is especially vital regarding Chinese herbal medicine. You have to ensure that specific phytochemicals do not contraindicate or interfere with the synthetic gonadotropins or trigger shots you're taking for an IVF cycle.
Total transparency across your entire medical team is non-negotiable. The acupuncturist and the endocrinologist should be operating from the exact same playbook to maximize the efficacy of both approaches.
So when you look at the entirety of this deep dive, the core reality is clear. Infertility is an immense, heavy emotional burden. The grief, the shame, and the isolation are overwhelming.
It's one of the hardest things a person can go through.
But the science shows us that the mind and the body are intricately biologically linked. The stress response is a physical barrier, but you do not have to carry it alone. And you certainly do not have to endure people telling you to simply relax.
Please ignore those people.
Seriously. By utilizing complementary therapies like acupuncture and highly customized herbs, alongside a broader toolkit of dedicated counseling and community support, you can physically lower your cortisol, reset your nervous system, and honestly restore your hope.
If you are listening to this right now and you are in the thick of that marathon, the most important takeaway is validation. Your feelings of profound grief, your flashes of anger, your jealousy, they are entirely normal responses to an abnormal level of biological and psychological stress.
You are not broken for feeling this way.
No, you aren't. Taking deliberate steps to care for your emotional health is not a luxury. It's not a side project. It is a vital, non-negotiable component of your medical protocol.
The finish line of that marathon might still be moving, but you don't have to run it with a broken compass. You have the tools to steady your nervous system.
You really do.
And that leaves us with a final thought for you to mull over. Since we've seen so clearly in these mechanisms that the mind and body are deeply intertwined, that emotional trauma can literally alter our hormone cascades and stall our reproductive organs, could the way standard medicine traditionally separates mental health from physical health be fundamentally flawed?
That's a huge question.
Right. What other physical ailments might we be failing to fully heal simply because we are ignoring the invisible emotional weight driving the biology behind them?